Today we're going to talk a little bit about our most recent metrics and where we are in the state dial. Talk a little bit about our Orange Plus restrictions, particularly the visitor affidavit that was rolled out. Talk a little bit about legislation that was introduced and approved, Senate Bill 20B001, COVID relief for small and minority businesses and arts organizations. That is tied to the levels in the dial, as well as is tied to a proposed program that I think is going to be discussed quite a bit, the 5-star program. Talk a little bit about testing and then answer questions. So real quickly, this is our, as of this morning, where we stood in the state dial. We remain in orange. We are enforcing stricter public health orders than those that are required by the state. I think there are a few concerning trends right now. Since last week, our incidence rate has gone further into the red. And so last week, this number was in the low 700s. Now it's in the upper 800s. Our test positivity rate has also increased. It is in the yellow zone, as you'll see in our local data, which tends to run a little bit ahead of the state data, the state capturing the data. Right now, our positivity rate continues to go up, and our hospital data remains in the yellow. In terms of looking at our local data, I think the overall incidence rate, you can really see since Thanksgiving in particular, our rate is going up. We've had a little bit of a drop over the past couple days. We don't know if this is a plateau or that this certainly isn't enough to be a trend. But you can see this is how far right now our incidence rate is exceeding that red level threshold. And then you have the orange and yellow thresholds. We are at our highest incidence rate that we have been able to confirm since March.
Steve, can I ask a question real quick?
Yeah, Patty.
Yeah, so John, my understanding is though, to move to red, we would have to have two metrics one is just for a very short period of time, the other one was for a sustained. So we're not really, from what you're showing me here, in that dotted red line on anything but one of the matrix.
That's correct.
Metrics.
Yeah. So no, you're right about that, Patty. I think the concern is that as your incidence rate goes up, oftentimes one of those other metrics, whether it be test positivity or hospitalizations, can follow. And so the incidence rate tends to be your leading indicator in the state dial.
But technically right now we're just above it in one, but the other two are steady. Well, we'll have to keep an eye on them, but right now we wouldn't technically qualify for red.
That's correct. And so just real quick, I anticipated that in the next slide. I'll go back in a second. But movement from orange to red, you have to have one metric in the red for 14 days, which our incidence rate clearly has been. And then another metric in the red during that same time period. And CDPHE will have the conversation about the county moving into the red. To move back down a level into yellow, all indicators have to be in the yellow and or blue or green zones for 14 days in order for us to move back to a less restrictive level in the dial.
So that would be from red to orange.
Yeah.
George has a question.
John, I'm just curious, looking at these stats, how much has that impacted, or have we been impacted with from the St. Regis?
Well, so in our incidence rate is calculated, based on the, you can see that's probably some of the spike that we're experiencing, George, in this part of the graph is St. Regis. Now, whether the state, what I don't know is what portion of the St. Regis interns are considered Pickens County residents, meaning 30 days or longer. So I don't know exactly how that's impacting our state data, but overall, we're averaging about now 14 cases a day.
Okay.
Sorry, it's
You got ahead of yourself.
yeah, I got it, or behind. Test positivity rate has been increasing also. We're in the orange level. You can see we're not right now staying between. We did expect this to go up. We had identified some data that the state wasn't capturing that we're capturing locally. The test positivity rate needs to go up to 15%. Our local data is now showing us at 12.2. We still anticipate, with all of the testing capacity that's been brought online and testing capacity that's being used, that our positivity rate will come back down, but we're watching that one closely. It continues to go up. And then hospitalizations, I didn't pull their matrix forward, but they are in the yellow, and that is based on having up to 2 admissions, and they can be anywhere in the state. So 3 in a 14-day period, 3 per day in a 14-day period would push us over into the red on that
So
metric.
would you explain what that means? Because I think there's a difference in what we thought it meant.
Yeah.
As far as our local hospital or any hospital in the state.
So we had been tracking very closely our local hospitals, so AVH's capacity, as well as our immediate community like Valley View and such. But we're really tracking AVH as the hospital that primarily serves Pickens County and their capacity. The state is measuring anyone with a Pickens County address who is admitted to any hospital in the state gets counted against the statewide metric. So it is a much, frankly, it is a metric that would be much easier to have tip into the red than we had thought.
Now, didn't that understanding of that change over the last couple of weeks, where we always thought it was just the impact to our local hospital, and all of a sudden it became an impact to any hospital in the state?
Yeah, it's about 10 days ago or so that change in measurement became clear to us. And so we are adding on our website, looking at both how the state is measuring in terms of admissions as well as our local capacity, because obviously we need to understand where our local capacity sits in making policy decisions, and then also how the state may be looking at our data in terms of imposing a policy decision.
So for example, if I was a college kid at CU Boulder, and I ended up in a Boulder hospital, but my parents' my mailing address was 81611, Pickens County would get credit for that kid being admitted to a hospital in Boulder.
That's very possible if they didn't list a residential address in Boulder, a dorm, or a, yeah.
So that's something we really need to follow, because I'm not sure I agree with how they're calculating that metrics. Thank you.
Yeah. So in terms of our additional orange requirements, that's an eye test. I'm sorry, I think we've gone over the orange plus before. What is new was launched on Friday is our travel affidavit program. And so we've got right now the requirements, the program details, exemptions, compliance. We've got all of the information out there. The affidavit itself is pretty simple to fill in. You have your contact information, usual residence. I don't know if it's going to let me go forward without filling it out, but then it will go on to ask for attestations about being symptom-free, understanding the requirements around masking, our 5 commitments to containment, 3 Cs, and also affirming that you have had a COVID, you've been symptom-free for 10 days prior to travel, and you've had a COVID test within 72 hours, a sample collected within 72 hours of traveling to Pickens County, and that you will be able to produce a negative test result. The affidavit is out now so that we can start to communicate it to our guests through our partners. The affidavit will not be required until December 14th. So anyone traveling December 14th or after, but we have gotten it out so that travelers coming into our December and our holiday season are aware of that requirement and have an opportunity to start filling it out now.
Travelers for at least one overnight stay, not just if you're coming up to go to the grocery store.
Yeah, so travelers from Garfield and Eagle counties are exempt, and then it applies to all overnight travelers outside that area.
George?
This is, as I think I saw in one of your quotes, this is a very unique program in the country, and I wonder whether we'll be able to get any state or even national press about this that would help pass this information on to people who are planning to come to Aspen Snowmass.
Yeah, thanks, George. We had a press conference with a number of state media outlets. So we had most of the Denver channels, major Denver TV channels. We've had coverage in the Denver Post and Colorado Sun, as well as locally. We are getting our information put together in partnership with our lodging community and such. We'll be getting messaging out through their channels to overnight guests. We have also been working with our airlines, and they're working with us to message the requirement not only at the airports, but we're hoping to be able to be included in the text messages that they send out to their customers prior to flying and such, to make sure that there's a good notification. A number of states have done this. I think we are the only county in the nation that's doing it on our own right now.
Yeah, so I've been hoping that perhaps AP would pick this up as well, because it's so unusual, and given that Aspen has such a name recognition as well.
Mm-hmm. We will keep plugging it. We certainly have been trying to get the word out, George, and hope that really what's really important is that we get the message out, particularly through the VRBOs, RBO kind of facilities, as well as our lodging communities, so that anyone coming in here to spend the night understands this requirement in advance of their trip.
What about GA?
Greg?
Sorry, Steve.
Yeah, George, to answer George's question, I'm fairly certain we're going to get some publicity on a national scale to this, and I think so far what I'm hearing is that it's a pretty positive. People are enthusiastic about it and supportive is what I've heard. But I can anticipate we're going to be getting some more attention media-wise about this. And I did want to say that I'm hoping we can refine the messaging around it regarding enforceability, or there'll be ways to, this is a tough one. How many rules happen, anywhere where it's pretty hard to enforce, yet you make the rules and you share them with the public, and I just think that the messaging on that's got to be, clearly you've all been thinking about it. It's something that I'm concerned about. I have had people call and ask if they were exempt, like pilots have called. Said, well, we only fly in for a couple of hours. We need, we have our own stringent rules. So if we could talk about who's exempt from this, livery services or whomever, people are coming in and out quickly, that would be good to know. But and then I did want to talk about, just bring up the idea of, how do we incentivize people? Really, it's going to come down to doing the right thing on an individual basis. how do we incentivize people to embrace this and understand that it's for everyone's health and safety?
Yeah. So there are a number of exemptions. So the affidavit is required for all visitors staying at least one night in Pickens County on or after December 14th who are 10 and over, or an unaccompanied minor must complete and submit the online travel affidavit. Unless they meet one of the exemptions below. Commuting for work or school. People regularly commute at least weekly outside of Pickens County to a fixed place to attend school or work, or any person who regularly commutes at least weekly into Pickens County to a fixed place to attend school or work, provided that in their case this exception applies only to and from the person's residence and place of work. Patients, I won't read all of these, patients seeking or receiving medical treatment, and military personnel. And so Greg, in the example where you have a pilot who's flying in and then turning around and coming out, they would not qualify as an overnight visitor.
Great, thanks.
So Steve, real quick.
Patty?
Yeah, John, how does it affect GA, the general aviation? How are we gonna notify them? Because that's always a concern that people bring to our attention, is our lack of ability to deal with GA travelers.
Yeah, so we did have the FBO in our meeting last week. They're working to get they'll work with us to get the messaging out. Will the net be perfect? No. And so we're also going to work on having collateral at other touch points, whether it be restaurants or trying to work with SkiCo, so that places people will go while they're here, they're seeing the message that this affidavit is required.
Great, thank you.
Kelly?
Yeah, and Patty, I'll just share my experience that when I received some complaints about the FBO, I sent them along to Rich, and he immediately reinforced with them the expectation that they are communicating to incoming. So if you are hearing that, just send that along right away.
Great. Thanks, Kelly.
Okay. More questions on this?
John, I only wanted to say thank you.
Yeah.
I am really happy, grateful to see this. I know it was a rush, and you all put so much effort into making this thing happen, and I am incredibly impressed with that the affidavit program has come out and rolled out, and it looks as good as it does. I think it's a great thing, so kudos to everyone involved.
Great, thank you, Greg. And this was really at the leadership of the Board of Health. Greg, I know you were pushing for this type of program early on, and the Board of Health really gave this direction, and I'm glad we're able to respond with a program that I think is going to have some effectiveness for us as a community. Okay, this is a super busy slide. Sorry about that, but just wanted to review with you that the state legislature did meet in special session. There were a number of bills passed, so I'm not going to review all of them. However, this bill, the COVID relief, small minority business and arts organizations bill, is one that's going to be coming up in conversations over the next week. Basically, the state has designated $37 million to be available to certain restaurants, bars, gyms, and movie theaters that are impacted by COVID restrictions. In particular, the requirement is that a county must be in the red zone of the dial by December 10th in order to be in order to qualify for a per capita distribution of these funds. There are some off the top kind of pieces in that 37 million. In total, Pickens County on a per capita basis would receive about $102,000, just over $102,000 to implement a business relief program for going into the red. The Colorado Department of Public Health and Environment had contacted staff, so Jordana and I were on that call. We did have a request from a Board of Health member, Greg. I'm sorry we dropped the ball on getting you on that same call, but the ask of CDPHE was, did Pickens County want to reconsider going into the red zone in order to qualify for these funds? We will be having our indication was that we had been having conversations with the community and that we thought it is important to be consistent with the two metric measurement and expectation of going in to the red, but that we would have that conversation. We have a Board of Health meeting on the 10th where we would present this information. We're also having a business community meeting to make sure that they're aware that the aid that the state is putting on the table is contingent on us being in the red. And so that's one discussion that's going to happen this week. $102,000 would not go very far. I think if the board were, I think the ask would come back to this board to supplement business support further if there was going to be a serious discussion about going into the red before our metrics fully went there. So that's, we wanted you to be aware of that and want to have a conversation with this board, make sure you're aware of it and that staff is going in the direction that you want us to go. The other piece, which we'll talk about in the next couple of slides, is there appears to be a link to a proposed that should be 5-star, not 5-start state certification program that would allow businesses that meet certain certification requirements to operate at a lower restriction level. And I want to talk about that a little bit more. We don't know exactly what that program is going to look like yet. But I do think that discussion has potential to move quickly, and we're going to look for some feedback from the board on that. And so the next few slides really talk about the 5-star program, but I'll stop talking.
Let's go with George and then Kelly and then Greg.
Yeah, this is pretty interesting. I would think that we would have much more severe economic impacts by going into the red than taking what's relatively not a whole lot of money to be distributed throughout the community. So hopefully the Board of Health will really understand that, especially going into the holiday period, how that going into red would really impact our entire community in all segments. So, yeah.
And George, I think the policy question for you guys is, one, whether the state dollars are incentive enough, and or are there, the other way to mitigate is with local resources, which is a discussion we haven't had.
Kelly?
Thanks. Yeah, I'll just offer to reaffirm what George said. George, our CCAT and our CCI allies work hand in hand in the creation of this bill, and they've all said it's not worth it to go into red. I do want to point out that the maximum grant is $7,000, and the cap on businesses is for businesses that make 2.5 million or less in revenue annually. So there are some further, I think, shrinking down of the relativeness of the program in our community. You may have seen an email that came in from CC inviting us to a discussion about this. I followed up because I was of the impression that we would not qualify, even though we're in an orange plus. So that email was inviting us to this conversation about how we would set up this specific program if you were in the red or if you were in the orange with additional metrics. And the clarification I got there is that you don't, if you're in the orange, you can't just have additional protections. You also have to have additional restriction on capacity. So because our restaurants are still opening, even at limited capacity, that would take the restaurants fully off the table for being eligible for this program. You know, there might be some eligibility for, say, gyms that have a cap at 10 people. But otherwise, you know, I didn't want anyone to get confused by that invitation that we would qualify, because I think our qualification is mixed at best without going into the red. And again, the program is just super limited. So I just want to reaffirm, you know, George, I think you're right. I don't think that there is value here moving into the red for our community to go after such a limited fund. But I do want to have the broader conversation about, you know, what we might be able to do locally.
I was just I think I would echo what I've heard already from Kelly and George. It simply isn't worth it. And when it comes to the Board of Health, I don't know how easy it would be to get the actual data on what sort of volume of business we have. You know, it seems to me that 102,000 spread thinly across our community is going to be a slow night in an Aspen, in our restaurant business, for instance. It amounts to peanuts. And I want to make sure that everyone on the Board of Health understands that as we're talking about this. So maybe if there's some data on income or, you know, gross sales or something that we could share for reference, it might be useful.
Yeah. And Greg, we can probably do a quick estimate based on sales tax numbers.
Steve, can I chime in? Steve?
Yeah, Patty?
Yeah, and that might be a conversation for tomorrow's business meeting with ACRA, because I know the restaurateurs will be calling in on that. But Kelly, did you say that it's capped at $7,000 per business, $7,000 per business? So it wouldn't be like one business got the whole 102,000. They'd only get 7,000, which would be that. Yeah, I mean, it doesn't even. It's just doesn't make any sense for going into red.
If you make $1 million, you can get a $3,500 grant. I think if you make between $1 million and $2 million, you can get a $5,000 grant, and if you make up to $2.5 million.
Yeah, and in light of that, for what it would do to the employees of those restaurants, not just the owners of the restaurants themselves, but the employees, how would we compensate the employees who are already having a hard time paying rent, putting food on their tables, paying their utility bills? And it doesn't even come close. It does not even come close. The only thing that comes close is allowing them to stay open of at least 25, if not seeing if we can't get some period of time at 50% of allowing them to be open. This is the time of year that these businesses make their money for the rest of the year. And if we lose these businesses, they're not going to come back in June or July, or they may be gone forever, and we have to keep that in mind. The other question I have really quick is if we have an uptick in cases, when we have an uptick in visitors to our community, do they track by their zip code, or do we get credit for them locally?
If they are here for 30 days or more, we get credit for them locally. If not, it goes back to their
place of residence.
So,
and I say get credit facetiously. That's pretty sarcastic.
But I do think, what we know is that we've got a number of second homeowners. I think we've seen a run, all the mountain communities have seen, I think, an increase in those long-term visitors, who may be staying here for a number of months or a year. Typically, those second homeowners can account for up to 10 to 12,000 people in our population, which is almost a 40% bump. That's probably a little bit higher right now just because of what's happening with national dynamics, but we are measured against our census population of just under 18,000.
We don't get credit for that extra 10,000 people that are living here longer than 30 days.
Okay, well, because this deadline was coming up, I wanted to be sure the board was aware of.
I think.
Oh, I'm sorry.
I thought there was another
John,
question.
Patty does have a point where we could have twice the population here, counting all the visitors. Our incident rate could go up higher, but it would actually be it could be a smaller percentage of the total number of people who are here. But we don't get credit for that because the extra visitors are only here for a week maybe. So we could actually be potentially in better shape, but the metrics aren't going to show it. It's going to show us being in worse shape per person who is in Aspen.
Yeah, no.
There's no avoiding that. That's the way that state counts it.
That's correct. And we know our census population is right around 17,000. I think 756 is what's being used. Our daily population, when you count second homeowners, when you count visitors, when you count commuting workers, can top out at 53,000. We've been anticipating that population is lower, of course, during the pandemic. We've been estimating it between 39 and 42,000. And that's tracking pretty closely when we look at utility usage, whether it be water, wastewater, electricity, or such, that we're tracking just a few percentage points below typical peak populations seasonally. But the state measures the incidence rate according to census population. We have definitely had those conversations without a lot of success in the past, and understand that it'd be difficult to have a unique metric for each county. I want to pivot a little bit to the 5-star certification framework that has been proposed by the state. And what it is it's based on a program that was started in Mesa County where businesses could be certified, and as a consequence of that certification, they could operate with less state restrictions. So basically, in terms of what's been proposed by the state, is that a business would need to have a written plan about how they are going to exceed state prevention guidelines, exceed local prevention standards, and have a clear compliance and enforcement plan, ensure 100% mask wearing, daily symptom checks by employees, along with a symptom tracker tool, ensuring regular outreach to employees and customers, to activate the exposure notification program on the smartphones, and recording contact trace data and information. And then they proposed specific business requirements, including things like table spacing at 10 feet and gym reservations and such. As a consequence, if there is a certification program that's approved by the state, what they are proposing is that if a county is in the orange level like we are now, businesses that are certified through that program would be able to operate at yellow capacity levels. Similarly, if you're yellow and a business is certified, they'd be able to operate at blue capacity levels, so on and so forth. I think one of the larger questions is, and I don't know how to get rid of that box. Oh, thank you, Jordan. Not Jordan, sorry. Is in the severe risk, whether there would be any benefit to a certified business. And so Mesa County, they've had Mesa County in a 12-day measurement program. They've been allowed to operate at orange, I believe it's orange levels of capacity, while the county's been in the red level on the dial. We are hoping to see some data from that this week. Just to give you an idea, Pickens County has already, really since May, been implementing almost all of these requirements that were in the draft framework. We currently have 918 business plans, and we've processed 341 event plans. I won't go through all of the industries. Not all counties in Colorado are requiring or have required business safety plans. So at a statewide level, it would probably be a change. It may not be as significant a change in terms of the process that we've already been following. The difference is we didn't ask for a variance to operate at lesser restrictions as a result of having that program in place. The reason I'm bringing this up is, one, it's been tied as an incentive for counties to potentially move levels voluntarily associated with the Senate bill that we talked about earlier. In terms of their timeline, they had set last Friday to review the progress in Mesa to determine if the program is compatible with level red restrictions, if there's evidence that those stricter business practices actually do prevent the spread. We do not have a clear date when we expect the state will share the results of that analysis. We hope that it will be later this week. The state has identified between the 4th and the 11th this week, so another reason I wanted to get this on your radar screen, to finalize parameters of a 5-star program with local public health agencies, chambers of commerce, restaurant industry, etc., based on Mesa County's results of operating in the red. I think there's a big question about whether again, these types of restrictions would apply in the red. December 14th, they are looking to publish final parameters of eligibility and operation, and then 14th through the 18th, look at standing up a program. This is a very, very aggressive schedule. Particularly, this would be an aggressive schedule for us in Pickens County, and we have already created a consumer protection program, and we already have a business plan process. It is a very aggressive program, particularly for counties that have not stood up a program yet. I think there's going to end up being discussion with the Board of Health as we get more information about what the program is actually going to look like. I know there is a letter from the Colorado Association of Local Public Health Officials that was shared with the board with some concerns, not necessarily about whether there should be a program or shouldn't be a program, but if there is a program, that program be evidence-based. That we have some evidence that reduced restrictions with these practices that are in the 5-star program are actually shown to reduce incidence levels. There is also, and Kelly, you may be able to brief us on the CCAT conversation. I think there is some additional conversations with CCAT counties about some metrics or standards that should apply before counties could maybe opt in to a 5-star type of program. There are concerns across the state about the administrative burden and the ability of counties to stand this up quickly, and whether this is a timeline that a successful statewide type of program could be stood up on, or whether we needed a little bit more time as a state and local jurisdictions. And you all might have others. Right now, we don't have a specific program to respond to or give a thumbs up or thumbs down to. We have this framework, but also a very aggressive timeline from the state. And so I wanted to be sure the board was aware of this, had an opportunity to talk about this certification framework, particularly for our 2 Board of Health representatives that could be either asked as early as this Thursday or called into a special meeting if a program is launched at the state level, so that we're starting to share some of this board's thoughts, concerns, and or excitement, whatever it may be about this.
Steve?
Steve?
Ben, Patty?
So John, yeah, thank you. And yeah, clearly it's a very fast timeline. What's great is that our community has been doing this, as you've said. I think if anybody is able to pull this off, it would be us, but still we need to know how heavy the lift is going to be for our staff to do this. And I want to go into the Board of Health meeting prepared with that information, so we know what we're obligating our staff to do. I think that the understanding I have about this and why they're even entertaining this program is that we certainly have counties, I guess described as the red counties, who just don't want to participate and don't want to put any restrictions on, and they're doing whatever they can to create incentives of some sort to get some level of compliance. So at this point, I'm not convinced that program is going to be super interesting to us, but I understand why they're doing it, and it's frustrating that it seems as that we're moving away from standardization at this point. But I want to go into that meeting fully prepared to know what it's going to cost to do this, but I also would love to know what have we already done to accomplish what they're talking about now, and how has it been working for us could be something we can share with them. As our numbers are going up, even though we've had these systems in place since May, what can we realistically expect to happen in Mesa County or anyone else who wants to do this?
And I would anticipate one of the things that we're going to hear, and one of the things that we need to talk to this board about, as well as the Board of Health, is that compliance is a key component of a program like this working. And so we've been taking an educational approach, seeking voluntary compliance with our businesses. In some cases where it's been egregious, we're going through the rigorous process of shutting down businesses and bringing them to court, and that's been a rare occurrence. However, for this type of program, it provides a different, I think, enforcement mechanism, may be a plus side of it, in that each business would be certified to operate at a higher level, and that certification could also be removed on an individual basis, which may provide incentive, for businesses to stay in strict compliance with the standards. I think the rub there would be that if we're really going to be operating on an individual basis that much and have that kind of enforcement capacity, we may need to talk about beefing up that consumer protection program to really make it effective. And so I'd anticipate that'd be more folks within that program to implement it. And that would be the only way, I think, to provide assurance that businesses were meeting any stricter requirements.
So Steve,
Okay,
Patty,
Patty, and then Kelly.
I just want to add on to what Greg was saying. And in this case, I mean the true value of the word credit. We are not getting any credit for the fact we've been doing so much of this for so long. And I find that interesting at the state level, why the state seems to be, it's almost a discriminatory thing. We've been doing all these good things and, with our business plans and with our consumer protection people and getting out there and working with our local business sectors. And we're still staying in the, even though it be bright orange, but in the orange, which we were hoping to stay in the yellow. But, and the fact we're not getting credit for the fact that our population has grown. So if you look at that other metrics on percentages, that number would be dramatically different, I believe, if the numbers of people who are actually living in our county were taken into consideration. So I don't know how we can pursue that as a state level without further causing issue, but I think it's important to note.
I think in the state's defense, in this case, we never asked for additional variances or such based on these practices. And so when Mesa County put their 5-star program into place, they did ask for the variances. We put these requirements into place as a basis to ensure we had the best public health practices in our community. And I think the big difference is we didn't ask for a variance. And so I guess in defense of the state, they're not necessarily giving it to us, but we never asked for it.
No, I'm saying, I'm not asking for that. I'm just saying that we're not getting any kind of support from the state by saying, we did this on our own volition. We did this because we knew it was the right thing to do. We didn't do it because we wanted something from it. We did it because our community needed us to do something. And that's the point that I'm trying to make, is that we've been ahead of this curve for a long time now, and for the state to be saying, well, if you don't go to red, you're not going to get that $107,000. And then at the same time, we're not getting credit for the fact we've already been doing so much of this 5-star program ourselves voluntarily because it is the right thing to do, and now not being able to actually utilize that to keep our businesses open during this critical time of the entire year, I think it's important to note.
Kelly?
Thanks. I'll try not to be all over the place on this topic. But yeah, Patty, I appreciate you and Greg identifying those concerns. It's, go into the red to get the money, but ask for a variance program so you don't have to restrict your public health behavior. It's to me, and this conversation is happening in a context of all the public health advice being to limit your activity and stay home and only stay with your household. So I do really think that it will behoove us, and I know you all will as Board of Health, and I know our business community continues to look at this through the public health lens, which for me is the most important thing. And, I'll just share what the CCAT advocacy has been around this, again, is echoing what you received from John from the public, CalFO, the Public Health Association, but also trying to give some really specific, I think, incentives as well as metrics that would allow this program to work. So specifically, that request was that anyone's incidence rate should be in the orange before they could qualify, and anyone's positivity rate could be in the red, but it should be declining for 2 weeks before you could qualify. And so those would be evenly and equitably applied when the state would consider such a program. Additionally, they've asked that there's some external certification programs that businesses can access that would evaluate their compliance and their public health protection measures. That the state allocates funding to counties who have been doing a good job in order to bring on these third-party certifiers to help alleviate some of the burden on counties to program. And then, you know, from an overarching perspective, not placing this program ahead in priority before disease containment demands, which are very high. You know, we've had this program, we set it up early on, we would probably need to invest more in it for it to be valuable, you know, more valuable in Pickens County. But other counties haven't stood this up, and they don't want it to come at the expense of, you know, they're putting out more testing, the contact tracing surge needs, et cetera. And so, you know, I will send to John to send through John to the rest of the board that advocacy, but that's what has been presented for CDPHE to consider when they're further looking at this program. And, you know, I would just say, you know, I actually do think that there is evidence in Pickens County related to this effort. Like, you know, we are doing a better job than surrounding areas. Our numbers are better than other places. That could change within the week, right? But all in all, you know, I think we are doing better, but I also think that we need to be really honest about where disease spread is happening in our community. You know, from what I understand from the epidemiology, it's not happening from restaurant patron to staff, but it's happening with workers in restaurants, you know, between workers, and it's happening in small gatherings. So is it happening between dinner party guests, even if it's not being transmitted from guest to staff? So I know you all will be, you know, eyes wide open about this, but it's, you know, Greg asked the question, what's going to happen in Mesa? I think they're going to keep their businesses open, and I think their numbers are going to continue to go up. You know, that's what I think is going to happen. And so I would, you know, just again, really think that keep the broader context in mind. And also, I continue to want to have the conversation about how can we help mitigate this? You know, how do we continue to have strong public health measures that I think are doing a better job for our community comparatively, but still be able to help our business community out? And I think we need to have a conversation about that today as well to help give staff some direction. You know, I'm disappointed that our CARES Act reimbursement isn't already in hand. You know, I'm very anxious to spend that money in a positive way, but you know, we don't know what that's going to be. We don't know if that's going to come in this week or next week, or but I would like us to give some direction to staff to seek input from the business community in the meetings coming this week about what that might look like while we continue to maintain our public health standards, you know, even if they don't involve additional capacity being offered to them. So
Ellie, Steve, if I could follow up very briefly, just looking at a timeline, we're also anticipating that the Thanksgiving bump in incidents is probably upon us, and we're probably going to go through Christmas the same way. So we might be facing, you know, another 6 weeks or more where we're seeing it getting worse rather than better. And I think, hopefully I'm wrong, but that's kind of what I've been hearing. And I want to make sure that we're discussing that when we talk to the business community and the Board of Health and everyone else. Is, you know, this is what we're looking at. The best data is telling us this. So Kelly, I completely hear what you're saying. And I think our obligation is really to do the best we can to take care of our community. And that includes our visitors coming from everywhere, as well as our workers and our residents. So I think we're going to do the right thing. It's interesting to have this distraction from Mesa County, but you're right. I think we need to stay the course, but keep our eyes open and watch and wait and see how things work. Thanks.
Steve, can I just tag on to Kelly too real quick? Yeah, Kelly, in light of the concern about the restaurant workers, their staff after work, I did get some information from a local restaurateur. I need to put it into a format that I can share it better as to what they're handing out to their staff. They can't really tell their staff after work. It's just like the NBA just did with basketball players. You can't do this, you can't do that. We can't tell staff people, you can't go over to your friend's house and, you know, have a few beers. We can educate them on that. So this was information that this restaurateur is providing to all of his staff. saying that this is what we expect of you, please comply because it's important for us to stay open. So I'll get that out, maybe I'll try and do it in a format I have to get to the Board of Health, because I think it really helps address your concerns, Kelly, about the transmission issues from restaurants. So that's something we might be able to get out to all the restaurant owners. On top of everything else, we're asking them, please make sure that your staff are aware of this information and do their best. So thanks, Kelly, for bringing that up. So I will get that into a format, as I said, and move it forward so everybody gets a chance to see it.
Well, John, my thought on the 5-star program is it's going to be very attractive to the business community, especially the restaurants, if they have this carrot dangling there that they could have 50% occupancy and follow all the rules and everything would be good. I don't think it's working in Mesa County. I think their numbers are going to keep going up because indoor dining is probably a huge place for super spreader kind of events. Each restaurant is like a magnet drawing customers in. People who are feeling crummy are going to want to get out and go to a restaurant instead of staying at home where they should stay if they're not totally well and don't have the virus. But people are not following those guidelines. They're frustrated with being at home. They want to get out and do stuff. They're going to go out and eat at a restaurant, and I think it's just going to get worse in Mesa County rather than better. So I kind of like Kelly's guidelines for the 5-star thing, that if your numbers are going down and you're not already in the red zone on the dial, that it's probably an okay thing to do to, give the businesses a chance to operate at a higher capacity. We might have to live with this for another year, perhaps, with, trying to have businesses survive on partial capacity. It's going to be really tough for them. But I'm skeptical of the 5-star program for counties that are in the red actually working. George?
Yeah, I have a sort of a different type of question, and maybe Greg, you can answer this. And I brought this up in the past regarding restaurants with the tabletops and spacing. So even though with our new health rules that tables have to be 10 feet apart, if the tabletops can accommodate 6 or 8 people and they are not within the same family, it's just a group of friends, they're not really having social distance. So I'm still kind of confused of how that is working or really addressing what we need to have for our protocols.
George, I don't know if I'm the right one to answer that, but I agree with you. In a recent conversation with Jill Ryan at CDPHE, she just said we need to keep remembering the community spreads happens in indoor places without masks. It's sitting around a table, whether you're in a restaurant or in somebody's home. It's an informal gathering elsewhere, or maybe it's a formal gathering in a restaurant, whatever they want to call it. But this is where the spread happens, and we just simply can't get around the facts on that. And we're doing our best to dance around it with the way the restaurant regulations have worked. I think everyone's trying to figure out a way to make it work. But you've nailed it. It's right on the head. That's where we have a problem.
Yeah, I mean, maybe they have to have tabletops or just 2 people or 4 if it's a family, but you can't have sort of disparate people just sitting amongst themselves, because that's the same as that is an informal gathering in a public place. So maybe that's something Board of Health could talk about with the Restaurant Association and see how to address that, because their business their business is at risk.
Yeah,
and business than formal gathering. Yeah.
The most recent
and also just a reminder, it's about almost 20 till 12 right now, so we, you know, getting near the end of our discussion. So, Kelly, and then, John, we better get it back to John and, be thinking of wrapping it up at some point.
That's okay. I can forgo. My comments were just to, you know, maybe in our Orange Plus, ratchet, you know, seating individual families gets exchanged for like a curfew. You know, maybe that's an idea for a restaurant community to bat around. Like if you can agree to only sit, you know, in household, you know, you can stay open to midnight or something. You know, I don't know, but that's it.
Okay. I won't spend a whole lot of time. I think right now not a whole lot is necessarily changing this next week on our testing. We have free COVID testing sites with no doctor's referral required in Aspen, Snowmass Village, and Basalt. Also the unincorporated Pickens County at the airport. And our website lists a number of testing resources. And anyone that clicks on the drop-down menu, you'll get your website where you can schedule what the test type is, that sort of thing. Whether it's free, whether it's paid, all of that, what the cost is. So anyone who wants to get a test in Pickens County should have fairly easy availability to get it now. We will just continue to encourage that. We are hearing that the state is working on continuing funding for the testing program through the first quarter of the year, so through March. You may recall we had thought a lot of the testing that we were able to take advantage of through the state would end on December 30th. It's looking like they have been able to find some funding. We're still waiting for the exact details on that, but we'll be reaching out. And frankly, I don't know if it's going to change all of our plans a whole lot other than to give us opportunities to build on what we are already planning on doing. So I think we're going to have opportunities to continue to expand testing availability, and we'll be looking at those. I wanted to zip through that because, Kelly, I think you had raised a discussion that may take a little bit of time, and it's kind of an if-then discussion. You know, if we were to get fully reimbursed on these coronavirus relief fund dollars or receive more than we had anticipated, and the board might recall we've projected a reimbursement of $750,000, roughly $400,000 of that coming to Pickens County. We've requested around $4.5 million. And so if there is a gap, frankly, between what we've already estimated and what we actually receive, and I think this is where your comments were going, Kelly, is do we want to start to identify or prioritize some uses for that funding so that staff can start thinking about programs so that if and when we're awarded that funding, we can hit the ground running versus starting from square one once we know what it is. Is that a fair summary of where you're trying to bring the discussion, Kelly?
That's exactly what I had hoped to have the board answer today. Thank you.
So I'm going to throw it out to y'all.
So Steve?
Patty?
Yeah, so we don't have any idea. We're still waiting with great anticipation as far as the award of these excess CARES Act funds. Correct, Kelly?
Well, I have a little more detail than that. You know, there is money in the reserve that remains, and there's additional deobligated funds that will be coming from counties or jurisdictions, I should say, that aren't going to use their full initial amount will go into the reserve as well. And, you know, a chunk was already approved for the reserve that is already in the pockets of 46 jurisdictions. And then ours was set aside for further review because of some ambulance district requests related to durable goods that they weren't sure qualified. So the bulk of our application, 3.8 million, I understand, is direct expenses clearly qualified under the CARES Act. Now, because that's in a bit of limbo, there are more applications coming in, which means the pot may need to be divvied up, and it's unclear if everyone will get their full reserve request. I've been very heavily lobbying for an answer because I feel like we were told we would have an answer around November 13th, and obviously this is weeks later, and that the bulk of our expense is direct qualified expenditures that should clearly be covered. So that's my advocacy on our county's part for that fund, and we're told that they will make decisions by the end of this week. So that's why, you know, my hope continues to be we'll get the full amount requested. If not, then the 3.8, and if not, then something not far off that. So that's why I've asked John, you know, we haven't given direction to staff from this board what that money might go to. And, you know, I think standing up a small business support program, I think we should consider that. I think we should ask the business community how they best would envision needing that support. And I also think we should keep in mind, you know, what might our Health and Human Services, emergency economic assistance needs, you know, should we check in with them to see what those might be in the coming months and determine maybe some of that money goes to that too. But, you know, we haven't given staff any direction, and you know, hopefully we'll have an answer soon or by the end of the week to be able to start mobilizing that money.
And maybe to add some context there, obviously, if we're going into greater levels of restriction and or as we implement the Orange Plus, I think you're going to see more pressure on business, to Kelly's point, particularly if we end up in red. That also leads to impacts on individuals. We're still seeing some food insecurity. I think we have a good nonprofit model addressing that, as well as housing and you know, whether it be ownership or rental gaps. So individual assistance, particularly if there's more closed down and increased unemployment, will be an issue. I think based on what we know today, and I think we need to acknowledge that this is very fluid, so the circumstances do change on us, but it does seem like from a testing perspective, we've got a good game plan right now to maintain capacity, and the fact that it looks like the state is going to continue to invest more and make that available is frankly nothing but good news for us. So we probably won't have additional needs there. Based on our previous discussion, we may need to prioritize some additional investment in our consumer protection program if it's going to keep capacity up through the time that we have a broadly distributed vaccine. And so I think there are a few buckets. There's the business support bucket, individual support bucket, and you'll recall when we went into shutdown in March, we provided over $2.5 million in individual assistance. We didn't really provide much on the business side. And then you have the consumer protection bucket, and there may be another one. I'm trying to define some categories for you all to talk about.
Steve?
Well, and I would just note that, you know, the state also has $60 million in housing assistance. So it would help,
right.
you know, if staff could look into how that might get down to us
Yep.
as well.
Patty?
Yeah, just real quick, in speaking with just a few of the business sector folks, the restaurateurs, their primary concern, of course, is to stay open. The funds would be great, but that's not gonna cover the losses to their employees. So, or to their business, actually, over this next couple of weeks, because of the impact of this holiday, as I said earlier, to their overall, income for the year. So, I think that, again, the discussion tomorrow with ACRA, John, are you gonna be attending that?
Yeah, so Phyllis is going to cover for me
Here.
in this meeting. I'm going to try and attend that one.
So if we could really, really pick the brains of the business sector as to what their needs really are, so we can focus on that, rather than just, if they think setting up a small business fund of some sort is beneficial, or if they think it's better to put the money right directly towards their, I don't know, that's a question that needs to be answered by the business sectors tomorrow as part of the ACRA meeting. And again, we want to thank ACRA for moving that forward, the meeting tomorrow.
George?
Yeah, we're fortunate, Aspen's fortunate enough to have ACRA to be a spokesperson and a conduit, but I'm not sure that, or how are we coordinating with the businesses up in Snowmass Village?
Yeah,
and the other businesses.
We've got representatives from Stay Snowmass as well as the Basalt Chamber also involved in these discussions, George.
And out to Redstone as well?
Yeah, Redstone businesses have been a little bit more challenging to capture because there's not a business association out there.
There actually is.
A business association?
There is?
Yeah, there is.
Yeah, if you have a contact, we'll be happy to do outreach to them. I wasn't aware of that, I gotta say.
Okay.
Yeah, I have an email from, that I'm gonna try to look up and see the name of a group there that I think might be the name you're searching for, George. I'm gonna be looking down at my phone if someone wants to talk, to start talking.
I guess my buckets weren't that helpful in getting you to prioritize. I think I'll just unpack what I heard Patty saying was that in terms of if I were to convert, Patty, what you said into priorities, I'd probably prioritize the consumer protection program. And then I wasn't quite clear how I'd prioritize, the next two buckets. But that the consumer protection program as a model to try and keep open through enforcement and education.
Yeah, again, I've been honest throughout this whole thing that I don't cook and I tend to eat out a lot, and I go to different restaurants and I sit in my little space and I watch how restaurants are doing things, and have created relationships there, and I'm very honest with them about, this is what you need to be doing here. You're close, but you're not there, and that's what we need for consumer protection. I think the restaurateurs and some of the small businesses would be glad, so that they can keep on track, because there's still confusion out there. Am I supposed to be keeping a list of names? Does that mean the temperature? I think just the clarification to help them so that there's not repercussions that are unintended for these restaurant owners. To shut down one restaurant owner is going to have a significant impact to their employees, and that's, what's the trickle-down effect of that. So I think if we could beef that up, since we do have some guidelines there, I think it would be helpful. And it could just be short-term. We don't have that many businesses. We're not like downtown Denver, that we could get out there and just do that outreach in a not, we're punishing you, but we want to help educate you, let's get it right and do it right, kind of a mentality. So I think that's critically important. Again, something I think we should get input from the restaurant business sector to see how we can best help them get things done right.
And then Kelly, if I were to take, I think you were looking for, is there a priority we would set to mitigate the impacts of some of the public health orders for our businesses, so that the pain wasn't felt so much as we move to more restrictive levels? And I think that might be where we need a little bit more discussion as far as priority for the board. So I've heard those two kind of ideas. Do you want to expand on that one at all?
Yeah, I mean, I support both, but I do think that, again, increases to capacity need to be directly related to improvements to public health. And so, perhaps there are, if there are things that we haven't been doing that will achieve that, then we should do those, right? Like, does that mean more surveillance testing among hospitality employees? Does that mean further, restrictions on how groups get sat? So those would be questions that I would want answered related to the consumer protection stuff. Related to the support mitigation, mitigation support program, I'm not poised to invent what that looks like, but I do think we're poised to ask what that could or should look like, right? So that's what my direction to staff I would like to be, is to dive into that. If we are in a position to have to inevitably restrict more, how do we support our businesses alongside that? And again, I can't presume to know what's going to be most helpful for them.
So Steve, just real quick, because I know we're running out of time, but.
Ready?
Yeah, I'm going to say again what I've said, and I'll try and get it even briefer, but we really need to be looking at, trying to think of the unintended consequences of our actions, because we know that a lot of our numbers are coming from these small social gatherings. If they're in restaurants, I think we can deal with that. If people are, not following the rules of group size and masking and et cetera. But if we close restaurants, but we have hotels open and skiing's open and retail's open, again, we're going to be pushing people to go get takeout and have small social gatherings, wherever they can, either in the lobby of a hotel or in a hotel room, without any kind of guidelines. And I think that is an unintended consequence that we do not want to be pushing people into. So I think we need to take that into consideration in our decision-making process. Kind of the lesser of all evils. It might not be perfect, but let's try and do the right thing the first time around. And thanks, Kelly, for getting this meeting, Kelly and Steve. I think this meeting was critical.
And just a late-breaking update, George, Apple News did pick up our affidavit program, and it went out on their platform.
Thank you, George. Or Elvis, or whoever you are upstairs.
All right, that's all I have for you all, unless there's more to discuss. I'm glad, Steve, Kelly, thanks for prompting the extra time to talk about this. We clearly needed it, and it will be an interesting couple weeks. We're going to learn a lot more.
Thank you all for being available.
John, there is a Redstone Community Association. It's maybe not strictly business,
Okay.
but I think the businesses are very involved in it. They probably run it kind of like a Chamber of Commerce sort of organization.
Okay.
Okay, I guess that wraps it up. If no one else has any other questions, we meet tomorrow at 10 in the morning with the executive session with the Open Space and Trails Board. So don't forget there's a separate Zoom connection that we have to go into to open our executive session. Then we'll all leave that and then go into a separate Zoom with the Open Space and Trails Board. So we'll see everybody tomorrow.
Thanks, Grassroots. Thanks, Terry.
Goodbye.
I love that lady. So John, 5 copies of that, you think, for Pickett County?
Mm-hmm.
Should I just take 5 to you think the SO might want 2? Do you think Joey will look at the document, or just Alex? Okay, and so I'll just do 5, 5, 5, and 5, but I'll give you the extras in case somebody calls and wants more. You want me to stash them in my little